Can you reach a pair of small gloves out of here for me? I can't reach them. The metal cabinet. You can put on the shelf. Thank you.
What's up, guys? Welcome to BFR Tuesday. Sorry I'm a few minutes late here, finishing up some patient care. Actually, give me 1 minute, but type in on the side, say hello, where you're at, so I know everybody that's here. And if you have any questions, type it into the chat in that upper right corner, and then I can be sure to answer that before I jump off. All right, give me 1 minute. Thanks. All right, hello from SoCal. Hopefully not too smoky. I was just in Yosemite last week. So beautiful. We were starting to get some smoke during our hike, so it was a little bit of a challenge. But man, I got to get back to SoCal. It's been too long. Hi from New Jersey. Hi, Louis. Can you try to post the links for the study discussed last week? I forgot to email you. Remind me again? Which? Sorry, I've been inundated. What study was that last week? Remember what it was about? I forgot. Okay, I'll try to remember. Or I'll go back and I'll listen to see what last week's podcast was about, and I'm sure I'm happy to post it. You can also look on my YouTube channel, and the YouTube channel should have a link to anything that I reference. And the YouTube channel is just Cara if you look under YouTube. It was a good one. Oh, that's good. It's always good when it's a good one. It's not good when it's a bad one. Good when it's forgettable. All right, any questions? Any questions for me? All right, Michael, at what points do we increase the weight on our BFR workouts? Assume that there is still need to be a progressive increase in weight to contribute to mass and strength gains. Yeah, you're absolutely right, Michael. So when we are trying to program, it's probably a little bit deeper of a subject matter than what we can do on one of these calls. But I tried with my patients, especially, try to block their year. So let's say they are big skiers. So during the season, they're going to ski a lot. That's their technically their season. If they're an athlete, then it might be football season or a soccer season or volleyball season, whatever. During certain parts of the year, when you have a specific focus on either a single event, like some of my bodybuilders do, or they have multiple events during the year, you kind of want to periodize your training so that way you can peak yourself at the times that you need and want peaking. And I recommend this for everybody, because otherwise our training gets very bland. When I used to work for 24 Hour Fitness, we used to say all the time, like, God, there's guys in here that are there every single day and they don't look any different than they did 3 years ago. And it's because they're not constantly adapting their workouts, and they're kind of doing the same thing over and over and over again. I don't think your body gets bored. I think you're right, though. You need to continue to increase either the resistance or the reps or the volume, or, it's got to be changed up a little bit to continue to challenge the body. So when we're looking for strength and hypertrophy, strength is kind of self-defined. Hypertrophy means just muscle size. And with BFR, we do it two different ways. We train hypertrophy using very, very low loads with higher pressures. So in the upper extremity, like using 50% limb occlusion pressure, or high pressure on your consumer model of the SmartCuff Gen 3. And we use very light load, not to failure. So you're using, you're doing your 30, 15, 15, 15 rep scheme with very light, like 20% 1 rep max. When we're doing strength, which is different, strength and hypertrophy are two different types of training protocols, we're going to do higher resistance, more like 40% of your 1 rep max, but we're going to use lower pressures. So we're going to use more like in the upper extremity, 40% of your limb occlusion pressure, or the light setting on your cuffs. So making these little variables, in my opinion, is very important. And you want to block times throughout your training program to focus on those specific items. So to your point, Michael, I would retest my 1 rep max or your 3 rep max every 4 to 6 weeks, and make a block of training, let's say a strength training block, make that 4 to 6 weeks, and then retest range of motion at the end of that 6 weeks, and then reset your calculations for your next block, which maybe is another strength block or a hypertrophy block or whatever you want to work on. And I normally, if you're new to BFR, you're new to fitness, I typically start with hypertrophy block or muscle size block, get used to the cuffs over time, and then you switch to a strength block when you're doing more loads. We're using lighter load in the front end, heavier loads in the back end, retesting 1 rep max or 3 rep max or 5 rep max every 4 to 6 weeks is hopefully answering your question. But absolutely, especially with these light loads, if you don't keep increasing the resistance, you're not going to see adaptation. And we see that in studies that are poorly designed, where people are not responding to BFR. And what we see is that they test 1 rep max in the beginning, but they don't, it's let's say an 8-week study, and they don't retest it at 4 weeks. Our study out of Jacksonville State, we retested every 4 weeks because we need to keep increasing the percentage of 1 rep max that we're using. Lewis, are the signs of overtraining in BFR the same as for non-BFR training? Yes, and I'm assuming that you're talking about central nervous system fatigue and overtraining. You're going to see decreased, you're going to see lots of muscle soreness and pain. You're going to see little tweaks in injury and things coming up. You're going to be seeing the inability to lift as much weight, decreased time for recovery, poor sleep patterns, irritability. All those things are the same. It's harder to do. Central nervous system fatigue is much harder to do with BFR because you're using light loads. And there's some studies to support this statement. You're more looking at with that BFR peripheral fatigue, which is the extremities, and getting tired here, which we all know when you're using BFR, you get that pretty easily. So again, another reason why we want to block our training. So we're going 4 to 6 weeks, then we take a little bit of a rest week, an active rest week, and then we go back. And so you're constantly going up and down with volume and intensity and all those things. I think I really need to do a whole long webinar, like an hour, 2 hours on block training for your resistance, and then incorporate it with whatever other things you're doing, aerobic training or running or training for a marathon or half marathon or a 10K, so that it all kind of makes sense versus, we're just going out and doing all these exercises. And I do have resources, if anybody needs it, to help with designing programs. Like if you need a year program because you want to get ready for the first half marathon, having somebody looking at your whole schedule and figuring out with you and getting a little bit of a coach, I think goes a long way to make sure you're getting the goals that you need. Lewis asks, would you recommend going lighter and moving to a hypertrophy protocol if doing more BFR strength training and feeling overloaded? Yeah, I would. Yeah, then you're doing more isolated exercises, more single joint exercises. You're doing lighter loads, it's less stress on the system for sure. Michael, for back and chest workouts, is there still advantage of using upper extremity cuffs? Do the cuffs still elicit a response in the back or chest muscles? Yeah, absolutely. So we get 3 responses when we use cuffs. We get a distal response, meaning the cuff is here and I'm getting response distal or away from the cuff. I get a proximal response, which means that I'm getting something closer to my midline, so shoulder, or in the lower extremity, be glute. And then we also get a systemic response, which means that the brain is doing things and your whole body is doing things. So absolutely, there's the only thing that we don't see an improvement on is really your core muscles. And so when we're doing core work, I don't keep the cuffs on patients or clients. I have them use the cuffs for their workout, and then do their core work either before or after their workout without the cuffs. Hopefully that helps. All right, I got time for one more question if anybody has one. All right, well, if no other questions, thank you guys so much for joining today. I will be back next Tuesday to answer any questions. And if I don't get any questions, then I typically will present something or a new study or something along those lines. But I keep these short because they're kind of a lunch and learn, and I'm on my lunch break and have patience. So yeah, thanks so much. Bye for now.